The commonest headache that brings people to the doctor are migraine type headaches. Migraine headaches are more common in women than men, 9 to 1. Migraine headaches tend to be unilateral, one-sided. Light bothers you, noise bothers you, and there is sometimes associated nausea. If you have that constellation of complaints with recurring headaches, 96% you're correlating with the diagnosis of migraine. So once we have that diagnosis, based upon severity and frequency, as well as based upon what comorbidities the patient has, we then pick a proper treatment for the patient. So a lot of migraine patients have cervical pain, neck pain, and some of them have underlying degenerative disease. 70% of migraine patients present with neck pain, and neck problems give you migraine. So we have a physical therapist as part of the clinic who can advise the patient with regards to their neck, their TM joint, etc. A lot of migraine patients, comorbid with migraine is also fibromyalgia. So they need physical therapy. So the physical therapist guides them and can actually have them come to the physical therapy center for that. The second component of the clinic is nutrition. There are several foods that can trigger migraine, the top 5 being nuts, cheese, chocolate, red wine, and MSG. So based upon what food trigger there is, the nutritionist can guide them. We also have a psychologist. A lot of migraine patients have comorbidities of anxiety, depression, and have troubles with coping. So the psychologist can help them with their coping skills and in the management of their chronic recurring headache pain. Each patient has a session with each of the therapists, and then at the end of it all, we come together and we discuss the patient as a whole, and everybody gives their recommendations. And based upon all the recommendations, we portray this to the patient and move on with, apart from the recommendations, medical management. Because there are many medications out there now that we are using for migraine. More recently, there's the advent of what we call the CGRP blockers, which are drugs that work on calcitonin gene-related peptide. One of the dangers in a migraine patient with aspirin or Excedrin or the over-the-counter drugs is that if a migraineur or a migraine patient takes an over-the-counter drug more than 2 to 3 times a week regularly, that can actually trigger a recurring headache called rebound headache, which is an analgesic rebounding headache. So we don't like analgesics recurrently. It can worsen the headache profile. Now you're dealing with 2 headaches. So there are some migraineurs that are very mild, and there are some that are having headaches 2 to 3 times per week. So we actually get those that have failed and those that need a lot more treatment.